Hey everyone, and welcome to RUBIN'S Mind Lab, where we break down the latest research into what it really means. Ever wondered what is going on in our neighborhoods and how it might affect our mental health, especially when something as tragic as suicide happens nearby? Well, today we're diving into a fascinating study that looks at just that. This research explores a really important question. We know that suicide is devastating for those directly affected, but what about the broader impact on a community, specifically on mental health care usage? The study's big idea was to see if living in a neighborhood where suicides happen more often makes people less likely to seek help for their own mental health. It is a bit of a twist on what you might expect, right? You'd think more problems might mean more help seeking, but this study found something quite different. So, let's get into what they did. The researchers looked at over 700,000 people across the entire Netherlands. They used a treasure trove of data from national registries, basically official records of deaths and healthcare usage. They followed these people for about 6 years, starting from 2015. Their main goal was to see if the number of suicides that happen in someone's neighborhood, we'll call this suicide exposure, was linked to whether that person ended up using mental health care services. To measure suicide exposure, they looked at death records and counted how many suicides occurred within a specific area, which they defined by a 4-digit postal code. This is like their neighborhood for mental health care usage. They checked records to see if people received a diagnosis for mental health issues from either their general doctor or a specialist. Now, they didn't just look at the raw numbers, they also considered what makes a neighborhood unique. They were super thorough and accounted for things like how old and what sex the participants were. But more importantly, they looked at neighborhood characteristics. Things like how socially fragmented a neighborhood is, meaning how many people live alone or move around a lot. They also looked at the percentage of residents who aren't native Dutch speakers, the number of low-income households, and how densely populated an area is. They did this because these factors might influence both suicide rates and the likelihood of people seeking help. And they wanted to make sure their main findings weren't just explained away by these features. They used fancy statistical models called multi-level Cox proportional hazard models, which are good for looking at how events unfold over time in different groups. So, what did they find? This is where it gets really interesting. The study revealed that more neighborhood-level suicide was actually associated with lower mental health care usage. Yes, you heard that right. The more suicides that happen in a person's neighborhood, the less likely they were to use mental health care services themselves. And it wasn't just a little bit of a difference. They saw a dose-response pattern, meaning the more suicides there were in a neighborhood, the greater the decrease in mental health care usage. Imagine a graph. As the number of neighborhood suicides goes up, the line for mental health care usage goes down. That is a pretty strong signal. But the story doesn't end there. The researchers wanted to know if certain types of neighborhoods were affected more than others. They looked at how neighborhood characteristics changed this relationship, and they found that neighborhoods with a higher proportion of non-Dutch residents and those that were more socially fragmented were least likely to use mental health care when there were high rates of suicide in their area. This means that in communities with more migrant populations and higher social fragmentation, the gap between suicide exposure and mental health care usage is even wider. To a lesser extent, this was also the case for highly socially fragmented neighborhoods. Healthcare usage was not as low following exposure to suicide in highly dense neighborhoods or in neighborhoods with more low-income households. Now, why might this be happening? The discussion section offers a couple of really insightful explanations. First, it is possible that the link isn't that neighborhood suicides directly cause people to avoid mental health care. Instead, the same neighborhood characteristics that might contribute to higher suicide rates like social fragmentation or economic disadvantage also contribute to lower mental health care usage, regardless of the suicide events themselves. This is a really important distinction. The second explanation is more about barriers to seeking help. For example, migrant communities might face cultural or socioeconomic barriers that make them less likely to use mental health services, even when facing significant stressors like suicides in their community. So, these neighborhoods, particularly those with more migrant residents and greater social fragmentation, might be experiencing the mental health impact of suicides, but not translating that into actual use of services. This points to a critical area where support might be desperately needed but not accessed. Now, like any study, this one has its strengths and limitations. A major strength is its nationwide scale and the use of registry data, which gives it a lot of power and means the findings are broadly applicable to the Dutch population. The long follow-up period and no dropout are also big pluses. However, there are limitations. Defining neighborhoods by postal codes is a simplification. Real social connections are more complex. Also, the study only included adults, so it doesn't tell us anything about how this affects children and adolescents, who might be more susceptible to the social contagion of suicide. And of course, the findings are specific to the Netherlands, so we can't automatically assume they'd be the same everywhere else. There is also always the chance of residual confounding, meaning there could be other factors influencing the results that weren't measured. So, what is the takeaway message? This study highlights a concerning paradox. Neighborhoods with higher rates of suicide are paradoxically the ones where people are less likely to use mental health care. This suggests there are communities, especially those with more migrant residents and higher social fragmentation, that might be silently struggling and could greatly benefit from more accessible and culturally sensitive mental health support. The researchers propose that initiatives like mental health literacy campaigns targeting immigrant communities and programs to build social connections in fragmented neighborhoods could be crucial steps towards preventing future suicides. It's a call to action to ensure that those who need help the most are not the ones least likely to receive it. What do I think about this research? I find it incredibly important. It moves beyond just looking at individual risk factors and highlights how our environment, our community, can have such a profound and sometimes complex impact on our mental well-being and our access to care. The fact that higher suicide rates correlate with less help seeking is a stark reminder that we need to think creatively about how we deliver mental health services and how we build supportive communities for everyone, especially for those who might face additional barriers. Future research could really dig into why these specific communities are less likely to seek help, exploring those cultural and socio-economic factors in more detail. It could also look at what types of interventions are most effective in these specific contexts. Overall, this study is a significant step in understanding the intricate relationship between our surroundings and our mental health. It is a powerful reminder that mental health is a community issue, not just an individual one. Thanks for joining me on RUBIN'S Mind Lab. If you found this video insightful, please give it a like. Leave a comment below with your thoughts, and don't forget to subscribe for more breakdowns of fascinating psychology research. See you next time.